COVID-19 study sheet. What is the virus name? SARS-CoV-2. What is the virus name? SARS and COVID-2. What does SARS or COVID attach to? It attaches to the cells via protein spike in its structure, ejects genetic material into host cell. COVID-19 or SARS, how does it attach to the cells? It attaches via protein spike in its structure and injects its genetic material into host cell. Mortality, COVID-19 or SARS mortality in the United States is 1.124 million. COVID-19 SARS mortality, 1.1 million. COVID-19 SARS mortality, 1.1 million. Rate of transmission, SARS, COVID, rate of transmission takes 4 days. One person infects 40 people in 12 days. SARS, COVID, rate of transmission is 4 days. Takes one person to infect 40 people in 12 days. Prominent morphs of COVID, Delta and Omicron. Prominent morphs of COVID, Delta and Omicron. How is COVID transmitted? By respiratory droplets, aerosol, and formite surfaces. How is COVID transmitted? By respiratory droplets, aerosol, and formite surfaces. How is COVID transmitted? Respiratory or airborne. How is COVID transmitted? Respiratory or airborne. How is COVID transmitted? Emphasis on respiratory and airborne. Side effects and symptoms for COVID is taste, olfactory, sore throat, cough, and fever. Side effects and symptoms for COVID is taste, olfactory, sore throat, cough, fever. Side effect symptoms for COVID is taste, olfactory, smell, sore throat, cough, and fever. COVID resembles acute respiratory distress syndrome. COVID resembles acute respiratory distress syndrome. COVID resembles acute respiratory distress syndrome. Pathophysiology affects of COVID. Pathophysiology of COVID affects lungs, attaches to type 2 pneumocytes, damage cells, and causes leaky capillaries. Pathology of COVID. Pathology of COVID affects lungs, attaches to type 2 pneumocytes, damage cells, and causes leaky capillaries. Pathophysiology of COVID affects lungs, attaches to type 2 pneumocytes, damage cells, and causes leaky capillaries. Pathophysiology of COVID affects lungs, attaches to type 2 pneumocytes, damage cells, and cause leaky capillaries. And that's it for this one. Hope y'all enjoyed. Peace.